Welcome to Innovations in Facial Plastic Surgery, sponsored by Athré Surgical Associates. Hi, I'm Dr. Raghu Athre, and I'm going to talk a little bit today about Dysport and Botox. Everyone has probably heard about Botox. Botox is so pervious in normal everyday culture that when we have a seminar, there's not a single person in the room who hasn't really heard about Botox in one way or another. Not as many people have heard about Dysport. Well, this short video is to tell you a little bit about what Botox and Dysport does, as well as the differences and similarities between these two things. First of all, what do these chemicals really do? They really relax muscle. These chemicals are utilized for basically three main areas of the face. Number one, this region right in here, or the glabellar region. Botox and Dysport are excellent for softening the levens, or the little wrinkles that come in right in that region right there. Number two, the wrinkles in this region right here, or the forehead rhytids. And lastly, the crow's feet lines. These are the three real main reasons to use either Botox or Dysport. There are some smaller reasons like hyperhidrosis or excessive sweating of the palms and armpits. However, these are kind of rare uses of Botox and Dysport, and they're not really going to be covered in this video. What do these chemicals do? Well, Botox as well as Dysport are basically toxins. Whenever a person hears the word toxin, they go, "Oh my God, it's a poison." That's true, but it's really essentially just a chemical. Basically, these chemicals are utilized to relax muscle. In essence, every muscle has a nerve which sends impulses that tells the muscle to contract. What Botox and Dysport do is prevent the transmission of impulses from that nerve to that muscle. That's it. That nerve regenerates those impulses in about 3 to 4 months. Hence, these chemicals last about 3 to 4 months until the activity of the muscle comes again. In this region right here, the main muscle is the corrugator muscle complex. The corrugator muscle complex contracts in this region and this region in order to make those lines. By relaxing those muscles, we flatten out the glabellar region. How about in the frontalis region? Well, the frontalis muscle comes down like this and attaches to the brows and is useful for lifting the brows. Well, contraction of that muscle can give people lines in this region. By relaxing that muscle, we can basically smooth out the lines in that region. In the exact same similarity, the orbicularis muscle causes these little squinty lines to form. By relaxing the orbicularis muscle in this region, we can basically soften the crow's feet lines. How long does Botox take? Well, administration of Botox or Dysport takes about 5 minutes. It's very quick, very painless, and it lasts about 3.5 to 4 months. Now, what are the similarities and differences between Botox and Dysport? Essentially, Botox was the very first chemical out on the market. Dysport's new, it's FDA approved, and it works in exactly the same way. It's just cheaper since it's manufactured by a different company. I use both products with equal amounts, and I offer the choice to my patients on which one they would rather have. What are the complications? Well, the primary complications with Botox and Dysport is a very, very rare possibility of getting something called ptosis, or droopiness of the eyelid. That reaction happens very rarely, and in skilled hands can be completely prevented. Now, there are tons of medical spas and non-medical personnel that offer Botox injections. Essentially, they're following certain preordained patterns on the forehead and face, and they treat basically all patients as a preordained pattern. One of the big differences about coming to our practice is that we tailor those Botox as well as Dysport injection to each person's individual face. I may draw a particular pattern to target a specific area on one person's face, and that pattern may be different on somebody else's face. Furthermore, when the patient comes back for repeat injections, the pattern may differ because their face has changed in the last 3 or 6 months. This is one of the most important reasons to see a facial plastic surgeon, because the surgeon can really tailor any treatment to a person's individual anatomy and their individual face. This is one of the most important reasons to come and see me here at Athré Surgical Associates. We don't have nurse injectors or non-medical personnel delivering any injection or any medical treatment. From the smallest injection to scar revision to rhinoplasty to facelift to Dysport, each time you come here essentially is a visit that you get to see me, and that treatment is tailored specifically for your face. Well, I hope this video has been somewhat informational for you with respect to Botox and Dysport, and if you have any questions, please don't hesitate to look us up on the World Wide Web at www.athre, A-T-H-R-E, surgical, S-U-R-G-I-C-A-L.com, or call us at 281-557-3223. Thank you again.